Welcome to the Brent Newham COVID-19 Overrepresented Children Pathfinder. My name is Shahan Ahmed, and I'm a youth oversight manager at the Youth Justice Board. Today, we are joined by a few guests to talk about the Pathfinder from its inception to evaluation. What I will do is quickly go over housekeeping. So this session will be recorded, and if everyone could please go on mute. We have a few speakers, and at the end we will be taking questions and answers. If you want to, please do put in questions in the chat board, and we will have speakers from the Brent Pathfinder. So today we have Nicola Roda joining us. From the Newham side, we have the project lead Chi Mamadou joining us. And then we also have from Cordis Bright, the evaluation team, we have Caitlin Hogan-Lloyd and Hannah Nixon joining us. So welcome everyone, thank you. Before we start, I'm delighted to be to welcome the chair of the Youth Justice Board, Keith Fraser. And he's just going to say a couple of words on the Pathfinder, and then we can go on and hear from our guest speakers. So welcome, Keith.
Thank you. And can you hear me?
Yes, we can.
Okay, brilliant. Thank you very much for that that introduction there. And from my perspective, it's a real pleasure for me to be here to introduce this session. It's extremely close to my heart. Back in 2020, like everyone else in the sector at the YJB, we were increasingly concerned about the effect the pandemic was having on children, and in particular, the disproportionate toll it was taking on Black and ethnic minority families. From the statistics we had at the time, we saw that Black, Asian and ethnic minority people admitted to hospital tended to be a decade younger than white people, and death rates were also higher. Hand in hand with the direct health impact of COVID-19 was the indirect impact too. The anxieties of many children increased during lockdown, with many seeing an increase in adverse childhood experiences, which are known as ACEs, as a result of experiencing grief, bereavement, discrimination, victimisation and separation. We had grave concerns over the mental health impact on both parents and children. Although there is still some more research needed on the impact of ACEs, research shows that those that have suffered 4 or more ACEs can be more likely to be involved in violence as victims, perpetrators, or both as a result. We know that universal offers or support can sometimes miss Black, Asian and ethnic minority children. So, as part of our targeted funding work to test approaches to difficult issues in youth justice, we funded 2 local authorities, Brent and Newham, to provide additional support to Black, Asian and ethnic minority families and children that have an increased level of ACEs due to the effects of the pandemic, with the aim of preventing them becoming involved in the youth justice system. You will all remember how hard it was for youth justice teams to maintain their services and support children during COVID, and they heroically rose to that challenge. Brent and Newham were asked to go even further and to set up a new project with our targeted funding. And I'd just like to put on record that it must have been incredibly complicated and not without a certain amount of trial and error. I'm really grateful to all of you involved in the project for the work you put into it, and I'm excited to hear about the results. Thank you all very much, and back over to you.
Thank you, Keith. I would now like to introduce Nicola Roda from the Brent Pathfinder, and she's going to just give us a bit more information from the Brent side of things. So over to you, Nicola.
Thank you very much, Shahan, and thank you, Keith, for the introductions. So I'm just going to share my screen now, so just bear with me one moment. Can everybody see that okay?
Yes, we
Yeah.
can,
Yeah.
Nicola.
Fantastic. Thank you very much. So thank you all for coming in to listen to our COVID Pathfinder. So I'm Nicola Roda. I joined the COVID Pathfinder project a little way down. It was already started when I joined. And my esteemed colleague who's here, James Salter, the service manager for the OS, started the whole thing and worked very closely with Daniel Rogers, another esteemed colleague of mine who I believe is here today. So I'm delighted to welcome them both. And I joined, so I was joined as the project lead, and I'm now the Youth and Youth Justice Service Deputy Manager for the Brent Youth Justice Service. So I've seen this project from a team manager perspective, moving into the project lead, and now as a Deputy Service Manager, and the changes and the amount of impact that it's made in our service. So I'm delighted to be able to share our findings with you today. Sorry, just bear with me. So the background, as Keith so eloquently touched on, was the COVID-19 pandemic of 2020, the most trying and challenging time for everybody across the globe. But when we looked at sort of the local things, so the COVID Pathfinder project began as the urgent response to the COVID pandemic, with the resulting crisis impacting the young people, and in particular the young people from global majority backgrounds, those who are disproportionately impacted by the subsequent repeated lockdowns. So in addition to the medical emergencies and the health crisis, there was also everything that sort of came from that. So in September 2020 itself, Brent was reported as the second worst affected London borough, which was really considerable and concerning. So why the London Borough of Brent? Why were we chosen for this project? Well, we have a population of around nearly 349,000 people in our borough, and 78% of them are global majority heritage. So we've got a really rich cultural background. 149 languages are spoken, and almost a quarter of people in the borough are children aged 0 to 17 years. So a vast majority of the borough were impacted significantly were global majority and of a younger age. However, at the same time as this crisis happening, we were Council of the Year 2020 and the London Borough of Culture. So we were in charge of sort of the London Borough of Culture and celebrating all of the rich cultural background, and COVID wasn't going to let us stop that. So even though the lockdowns meant that nothing could be face to face for a very long period, we actually had an audience of 843,481 people sort of still taking part and participating and watching the events that we still put on. So while we were deeply affected by the COVID pandemic, the spirit of Brent was very much still being celebrated, and the outlook of survival and really sort of persevering through this and coming together as a community and really being able to make sure that Brent residents could come out of this and to sort of minimise the impact, especially on our young people. So how were the global majority young people impacted in Brent? And as Keith Fraser said, the global majority young people were looking at sort of Black and Asian minority young people, so young people who's either born from outside of Britain or their parents were or grandparents. So we're looking at the global majority of these young people. The education and future prospects were significantly impacted. Overnight, young people were expected to suddenly come out of the classroom, sit at home and get some laptops out and undertake online learning, which we'd never done before. Many young people did not have laptops, did not have the technology to be able to straight away pick that up. And many young people didn't have the support networks in place that allowed them to have support from parents. Many of their parents were working and still had to go back out in the global pandemic. So probably could have been key workers or had to continue jobs, so weren't able to support young people fully at home. So there was a really serious disparity with a lot of young people in the area, and the challenges of online learning itself, and sort of sitting there and having that sort of 6 hours that you'd have in a classroom, trying to translate that to coming at home. And I know that every one of us who have children or brought up children in that period had very similar difficulties, but in very different way and very different support networks. So there was that tech poverty that really needed to be addressed. In terms of emotional health, that was absolutely significant. So when we were doing the project, this was a huge part that came up. A lot of it, when young people were talking about it, was that isolation of suddenly being pulled away from their friends, the loneliness of sitting at home and having to be a young person sort of locked inside, as it were, in their homes. And not having the social benefits of being in the school environment and being able to go out to clubs and just being generally a young child and a teenager in this time really, really significantly impacted. And also bereavement. So a lot of young people, and especially from global majority backgrounds, suffered significant bereavements. Many were grandparents, and in a lot of families, grandparents were very key figures in terms of perhaps would be living with them or would be very, very sort of close by, and close family relatives were lost, and even parents. So a significantly disrupted childhood, a lack of engagement in activities, emotional health had really taken a toll for young people across the borough. Another thing that was identified were the household conditions and poverty. So young people pulled out of the safe school environment, who were kept at home if they were already there was already domestic abuse in the household. Then this was exacerbated by the stress of COVID itself, but also the fact that there was nowhere to escape to. There was nowhere that they were able to go to kind of come away from these situations. And also in some cases, domestic abuse started while these young people were at home, and poor living conditions. So again, having the difficulties at home, poor living conditions, nowhere to sort of escape to, and no support to be able to have, or any sort of way of escaping that while the repeated lockdowns were happening. And young people talked a lot about the inconsistency. So we know that there was lockdown, then out again, then in again. It was a very, very, very challenging time for the young people in our area. So what did this project do and who was involved? So the COVID Pathfinder project, we looked at the mental health, education disruption, lack of opportunities. These were highlighted as the key areas. We of course looked at sort of everything all around that, but these were essentially the really key areas that came up. And of course the global majority cohort, so those were our target audience, and the young people that we really wanted to provide this additional support and this really significant funding to help them through this time, and to make sure that they weren't a lost generation, as so many were fearful of. And a big part of this was for mentoring and counselling with our partners of the Young Brent Foundation and each. So providing young people with support that perhaps in terms of their circumstances may not have met certain thresholds for mentoring or counselling, or there would have been long waiting lists. These were instant referrals where a young person could be identified, referred through, self-referred, to be able to go through this project, to be funded for mentoring and counselling on an almost immediate basis, which was a really, really good part of the project, as it meant that very low waiting times. So there was the youth panel was an essential part of this. It was really about gaining the voice of young people throughout this project, and giving, I suppose, a space for young people to be able to really talk through what it is they're feeling. Many young people talked about feeling that they couldn't talk up and say they're vulnerable, and the elderly young population were very much impacted by their health, and they felt that they couldn't sort of complain about their experience. However, it was extremely valid of the fears that they had for their own childhood, for their own lost experiences, for their education, for their mental health. And it was absolutely essential that those young people had the opportunity to speak out, and also to talk to each other about how they were feeling and how their experience was, and what they wanted to do moving forward, and to look at that more positive step of when this is all over, when we're able to come back out again, how do we make things better? So this was done through a youth panel with our youth participation worker and podcasts, to really kind of work with the young people and the media that they would like to do. And they really enjoyed coming to a studio and being able to talk through microphones and have that recorded. Was a really great experience. So we engaged young people in activities for diversion from offending, and also to really look at what they might be interested in once things were back out in the community again. And there was additional support within schools, which we'll go into a little bit later. But essentially there was the Roundwood alternative provision in Brent, was a school who were approached to work with our youth participation worker to come into the lessons and have a specific session every week to talk to young people in a space where they could talk about anything they wanted to, and to sort of mark a change of having that experience at the beginning and having that support, and then towards the end of that support being able to see how they'd moved forward. And we'll talk a little bit later about how we measured that, but it was a really effective thing, and it actually became part of the curriculum in that school, which sort of showed how much value the head teacher had placed on that. So this link is actually going to be sent to you all if you'd like to see it after the show, because there's quite a lot of things to talk about, but we've got an example of a youth panel which I think you'll really enjoy. So talking to a couple of young people about their struggles, how it's impacted young people. It's a really inspiring piece because young people are talking about their challenges, but really looking forward and trying to sort of look at the positive and step out and put their voice out there, which is absolutely brilliant. So we'll send that out afterwards, and hopefully you'll get a chance to see that. It's about a 7-minute video with our young people. So the conclusions here of what did the project and initial evaluation conclude. So from our sort of point of view, mentoring, coaching and emotional support are absolutely essential, but actually essential moving forward and as part of an ongoing support for young people. So those, for example, who were impacted, perhaps were 14 years old in 2020, are now 17, had to do a quick bit of maths in my head there, now 17 years old. And so the needs that they had back at the beginning of the COVID pandemic are very different to how they are now, but looking at what they may have missed in that period, and then how they can now overcome some of the gaps that they've had in that education and move forward. So really interestingly, one of the things we found in this project was that mentoring could at times be seen as something to sort of fix a problem and work with someone to get out of a problem and to sort of have support at a difficult time. Whereas coaching was very much about standing side by side with that young person and saying, what is it you want to achieve? What do you want to move forward to do? And how can we help you to get there? And work with you. So it was very much about looking at how we sold certain services and how we spoke to young people about what it is that they needed from our services, and making sure it was tailored exactly for them. If they needed that sort of mentoring and support, that's great, but then it could move on to coaching of being more sort of forward focused, which brings me into the next part quite nicely. So over the 3 years, the priorities changing. So for a 3-year project between 2020 and 2023, a very different set of priorities from right at the beginning to sort of coming out of it, what I sort of refer to as the aftermath of COVID. And for me, my colleagues, for all of us in Brent, it was very much about not allowing young people to think that they were the lost COVID generation. And despite all of the challenges that came after COVID with the cost of living crisis and a lot of really serious things happening as a sort of indirect result of COVID, the COVID pandemic, not just the health issues, but a lot to do with sort of future and things closing down and issues with sort of the cost of living, of helping young people to see that actually their future is positive, and they've been extremely resilient throughout this period. They've survived this period. They've been able to adapt instantly in an absolute significant way at a very young age. And now for them to look at bringing that strength forward and saying, right, now it's about my future. Now I'm focusing on what I want to do with this. So at the beginning of the pandemic, I was sort of in year 9 or 10. Now I'm moving forward. What do I want to do as a career? How is someone going to help me with that? And us really making sure that they had the support and resources to be able to do that, which again leads forward to the signposting. So once the COVID Pathfinder project sort of support for each individual young person was complete, it was about signposting and really helping that young person to understand what happens next. And now that they've completed their work with the mentor or with the counsellor, what do they need next to be able to sort of support themselves or to be able to access the right guidance to move them forward and to continue towards their future goals. The challenges and learning that we had. So the amount of young people in need versus resources. So despite these considerable resources that we were given in terms of sort of finances and the people who worked on the project, there still were a huge amount of young people in need. And again, throughout the sort of years, there'd be periods where the needs changed, and there'd be sort of ebbs and flows. So maybe a lot of people in certain periods of time. So that was certainly something that was a challenge that we needed to overcome, and overcame by making sure we had a very tight referral process and really sort of followed up on that, and ensured that if young people had to wait a little bit, that they still had that support in the meantime, and were signposted on when the project ended, because the resources had sort of stopped at that point. Another was young people being confident in having their voices heard. So having the opportunity to be part of the youth panel, but at the same time, maybe some of them being a little bit unsure about whether they wanted face on a screen to be seen, or their voice to be heard, or whether their voice would be heard. And a lot of young people reflected after the project, which we'll talk about in a moment, about sometimes feeling that they'll sort of say something, but will be the things that they say might not always be actioned, or they think, you know, they think that actually I need to sort of sit down, sit in my house and not complain because I'm here, I'm alive, I'm okay. There's a lot of people in hospital, but actually there was a huge amount of emotional impact on them, let alone all of the other things. So allowing them to really see that, be confident, speak up, tell us how you're feeling, and to validate that was really, really essential. So it was that challenge in being able to, and that was built up with the mentor and the counsellor, being able to build those relationships very quickly with young people and help them to understand it was completely valid. So there was a changeover of staff over a 3-year period, as would be expected. It's a long period, so that was something just to manage, and the changes to the working pattern. So the workers themselves working from home, it required a little bit of adapting sort of the working position. So right at the beginning, there was a lot of working from home, and then it started to ease out. But when we found that the workers could then do face-to-face, sometimes young people didn't want that anymore and actually preferred the sort of less of the face-to-face and doing over the phone. So it was about coaxing young people back out again after they'd been sort of locked away for quite a long period of time due to the lockdowns. And then the need for ongoing support beyond the project end. So just really us having time to really think about what comes next for us and how we're able to continue this support. So what can others learn from this project, this dissemination? The outcome star evaluations worked really well to chart the process, so the progress, apologies. So these were the evaluations that were done through at the Roundwood School with a youth participation worker. So right at the beginning, coming into the class with a chart that is the shape of the star, as you would expect, and goes through a couple of points. So how they feel about emotional health, education, well-being, physical health, emotional health, looking at sort of a scale of 1 to 5, I think it was, and charting that so that it sort of drew a very rough outline of a star. And then towards the end of their sessions, being able to chart that again and having those pieces of paper in front of a young person saying, wow, a couple of months ago you were a 2 for emotional health and now you've said 4. That's a significant change, and being able to use that to then talk about what do you feel has changed in this period and what do you need to get to a 5. So just using those numbers but having it visual seemed to work really, really well with the young people, and especially sort of year 9 upwards. The EACH and YBF organisations provided excellent support to young people, and again these are partners within that we work with in the Youth Justice Service, so ongoing partnership and just really seeing the benefits of the work they did with young people. Having the curriculum for at-risk young children in schools, so having a youth participation worker from the Youth Justice Service to work within a school and work with at-risk young people was really, really valuable. And having the head teacher say that it's benefited them so significantly has been amazing, and being able to chart the reoffending rate and seeing that it was very, very low, coming from a school where the young people already had experienced a lot of challenges, was really, really promising. The youth panel is something that we've continued beyond. So we see this as a legacy of the COVID Pathfinder project in the Youth Justice Service, of being able to maintain a youth panel and enabling the voice of children to be heard and to be able to record those and then bring them to sessions like today, sessions with the Youth Justice Board, and being able to have young people speak up and speak out and affect systemic change. And then the joint working of early help, youth justice service, social care in schools for the referrals, of really making sure that as many young people as possible could be included in this work. So the young people's voices. So at the beginning, very much as this is sort of a snapshot of the changes that evolved over the time. So the sacrifice, the lost generation, how unfair it was and how hopeless young people felt. These were words that were very much used and very much captured by young people before, around this project, as soon as it happened. And then later when they talked with counsellors and mentors and were able to move forward, the idea of being heard and their experience being validated and being supported and feeling really hopeful for the future was really significant. Just got a little snapshot here of young people's stories. So the slides will be sent out. So in order to not use too much time, we'll just go through one of them. So we had a young female of Black Caribbean heritage who was bullied, really significantly bullied. And when she came out of school to the lockdowns, it continued through social media, it continued through the online forum. So her grades were dropping despite being an intelligent young lady. So she worked with our mentors within Young Brent Foundation and was engaging with these positive activities that really helped her increase in confidence. And as such, she saw a very significant rise in her grades, and that real focus on sports and the feelings that she said that she got from engaging in sports and feeling really positive and confident in herself and feeling a real rise in her emotional health through being a part of sort of involved in sports. She actually went forward and became a sports ambassador for her school, which was a really significant outcome and something that she was very proud of and just really helped and could well be part of a career path that she moves forward for. So she continues to be supported in other ways towards achieving the goals of sort of a career within the sports field. What next is always a very big question. So once funding is stopped and once the project ends, how will this learning be embedded into practice? So in the Youth Justice Service, so and indeed the whole of early help in Brent Council. So the curriculum and at-risk schools, so we're considering the same sort of setup for other education establishments around Brent. So there's a lot of schools in Brent and there are a few pupil referral units and other sort of mainstream schools that would absolutely benefit from the same work the youth participation worker did, and really focusing in on someone coming in and working on emotional health and career pathways and things with young people. So that's certainly something that that can be continued. Mentoring, coaching and emotional health and education training and employment support will always remain priorities. And not just saying, right, this period is over now and we're back to normal. Is absolutely not the case. It's continued, and just really looking at what we've learned from those. Positive activities for young people to re-engage back into the community. So engagement with our Brent Family Wellbeing Centres. So at the beginning of 2020, the centres that we usually would be known as the children's centres, where sort of young parents would come in and get support for raising children, have been transformed over the COVID period to Brent Family Wellbeing Centres, working with children from 0 to 25 if special educational needs, but also everybody in the community, and putting on activities for young people and sort of positive activities, very low cost or free, and then looking at expanding that out to sort of sexual health clinics, clinics to look at the education hotspots, so periods where young people have to make significant decisions about school. We're looking at really expanding that in the Brent Family Wellbeing Centres, and that's part of my newer role as it changed throughout this project. The COVID questions COVID questions formed a part of our assessment criteria when assessing young people in the Youth Justice Service. So as a result of this project, in the asset assessments that you'd know of in terms of assessing young people who are in the Brent Youth Justice Service, COVID questions became essential in terms of assessing how a young person is managing in their emotional health. So asking, have they been bereaved by COVID? How has that impacted their education? And looking at all of that. And it still continues because it's still valid today, of a 17-year-old that comes in, what was their experience back in COVID? And we're still keeping that in mind when looking at how they've been impacted over the last few years. And then referrals to the turnaround project. So we have a 3-year project, the turnaround project for at-risk young people. So young people who want to continue to be supported on this could be referred to the turnaround project, but we're also continuing this project for any at-risk young people for looking at positive futures and diversion from offending in the Youth Justice Service. And that's it from me. So I've put here any questions welcome. I believe that we're looking at questions being in the chat or questions saved to after the presentation. But thank you very much for your time. Look forward to answering some questions later. Thank you.
Thank you, Nicola. I understand that was quite a lot of information. We will be taking questions at the end. However, if anyone did want to start putting them into the chat, by all means, please do so. What I will do is now introduce Chima Madhu from the Newham Pathfinder, and he will go through his presentation for you. So welcome, Chima.
Thank you, Shian. Let me see. Can you see my screen?
Yeah.
Okay, good. Right. Hello, everyone. My name is Chima Madhu, Project Manager for Newham's Pathfinder project. I would say it has been an incredible journey piloting the Pathfinder, from inception right down to the very end. And I'm really just glad to share, some highlights about what we've been able to do at Newham and the outcomes we're able to get just from implementing this Pathfinder project. Now, for Newham, just like Keith mentioned and Nicholas mentioned, the background was really around the impact of the pandemic. But for Newham, it was really a case of the disproportionate impact. When we looked at the deaths for Black, Asian, and minority ethnic communities, realized that they were more impacted than our, standard British white population. And as a result, there were increased prevalence of adverse childhood experiences for Black and Asian children, which again, we realized that these are key aspects that could increase their risk factors of coming in contact with the youth justice system. So in that situation, we also looked at the fact that in Newham, we had an overrepresentation of Black and Asian children in the youth justice system just prior to the COVID. And the whole aim of this Pathfinder was to then try and look at, with these key factors within the borough, what can we do, to support these children and young people? Again, we looked at what kind of packages could we put in place for the Black and Asian children specifically, those who are overrepresented, those who are dealing with trauma from as a result of the pandemic, those who are already experiencing different adverse childhood experiences. What can we do that will prevent them from getting involved in the youth justice system in years to come? And we set out to identify these children and families. We set out to deliver interventions for them. We set out to specifically work with delivery partners within the council and the VCS, and also promote system change. And when we talk about system change, we're focused on not just engaging these children and families at an individual level, but working with the system around them. So we're looking at how could we work with, the education sector, how could we work with the police, especially when we're talking about overrepresentation, how could we work with other delivery partners within the sector to ensure that, whatever we're trying to do is sustainable and has more impact beyond the children and families that we come in contact with. Again, from the impact of the pandemic, we're able to identify, several presenting needs. And at the top, as you can see, we have a child's emotional well-being, which is not strange. I think that's one key impact we've seen on the pandemic on children, their mental health being affected, their emotional well-being, and the impact of the lockdown again, giving rise to behavioral issues, lots of cases of behavioral issues that came out of the lockdown and then going back into school. And then we also have issues around bullying that also came up, the risks of exploitation, which again for us was very key to monitor because we're all trying to identify those risk factors that will bring them in contact with the youth justice system and see the interventions that we could put in place to help them not go down that path again. Respect to the demographics, we're able to, at the end of the day, engage more Asian young people. And this is not strange again, because in Newham we have a large Asian population. And when we look at those whom we engaged in schools, we could realize that the Asian population was really quite much. So at the end of the day, we're able to engage with more Asians, followed by Blacks, which were our key cohorts. And then with respect to age, we're able to engage, those between 11 and 15-year-olds. That was the highest cohort. And again, which emphasized our desire to prevent children from coming in contact with the youth justice system and intervene with them early. And we're able to engage with more males than females, which again reflects our youth justice data that shows that we have more males coming in contact with the youth justice system. Now, with this background, what do we set out to do? In Newham, we set out to, we had a wide scope of activities to cover. Now, for children and young people, one of our key activities was a one-to-one mentoring, which was again linked to the whole family mentoring for parents. And what do we do? Once we identified young people who, were experiencing ACEs that were impacted by the pandemic, we're able to assign mentors to work with them on a one-to-one basis, understanding what the key needs are, understanding the root causes, and then having sessions with them that will help them build resilience and overcome whatever it is they were facing. And again, for us, we didn't just want to do one-to-one mentoring, but we used the whole family approach, which was really quite impactful in the sense that we didn't just work with the child. We also ensured that we engage the family. Sometimes it was the parents, sometimes it was the siblings, identifying the root causes behind the issues that they were facing, because in some cases realized that the trauma from the pandemic was really quite deep. In some cases, the pandemic just, amplified the trauma that was already there. So, taking the whole family approach was really quite instrumental in understanding these issues, engaging not just the young person, but the parents as well, towards building resilience, understanding what to do, and equipping them with tips, to keep on faring better after the intervention. Again, we also did group work in schools around self-esteem. I think it was very important because from our one-to-one engagement, realized that there were lots of issues around low self-esteem, really impacted by the pandemic. Some were coming back into school very anxious. And because of that, we decided that rather than, while we address them in our one-to-one sessions, started to do group sessions with children in schools again, talking about self-esteem, what it is, what to do, and how to prevent it. And again, this was really quite impactful work by the end of the day. Another key thing intervention we're able to do was transition support. Coming back into school was really quite difficult for children after the pandemic, and it was just a slow journey for them, especially for those at the transition years from year 6 and even those in secondary school, because they had to come back, settle in, write exams, and move on to the next stage. So transition support was something that we put in place, to really help them transition from one stage to another, where we're able to have group sessions with them, understanding key things around bullying, friendships, preparing for the next level, what to expect, and again, doing it with creative arts, doing it with drama, doing it with very innovative ways of engaging children. Again, was quite impactful and welcomed by the schools, and it's something that we are keen to, ensure that it continues. We had well-being roadshows. These were pop-up shows that were able to deliver in schools with our delivery partners, both within the council and the VCS. This was really quite key in the sense that we're able to go into schools, have quick sessions with young people around mental health, around key issues, trauma, bullying, online bullying, things like that, and just explain to them what it's all about, give them tips on what to do, and most importantly, help them gain access to services that could support them when those issues arise. And again, employability support was one key aspect, ensuring that we're linking young people, who need that employability support to the various services that were available, and providing access to community spaces. Again, this was linked to our one-to-one mentoring, because we tried to make sure that our mentor is taking place in the community, in the homes, which was quite key. We had cases where, due to the lockdown and due to the fear of the pandemic, some children wouldn't want to come out, wouldn't want to go out again, but with this engagement, we're able to take them out into community spaces, restaurants, youth zones, and just help them access activities. Then we also had some diversionary activities, which again was some kind of key part of our engagement with young people, because once we take them into community spaces, once we're having sessions in gyms, in some cases, by the end of the sessions, we realize that giving them access to that gym even after the sessions would help them, engage in something positive. So we kind of ensure that we continue to give them access. For some was registration in football clubs, for others it was registration in basketball clubs, and that was really quite key in just helping them stay active with something very positive. For parents, we had the whole family mentoring, like I mentioned, and then we also had trainings around exploitation, helping parents understand how exploitation happens, especially with teenagers, how to deal with it, and providing them with a plethora of services, that would encourage them or help them get support services if they feel that their children were being exploited. The impact of the pandemic caused so much trauma in families, so we had trauma and support workshops for parents, where again it was just helping them deal with their own trauma, helping them understand behaviors that could be trauma related from their children, and then helping them understand how to approach that and how to address that, which was also quite impactful for the parents. We had counseling for parents that needed it, and we also then provided access, because one thing we realized that the needs were quite much. The impact of the pandemic was really quite extensive. So in most cases, we did the signposting, providing access to parenting support, housing support, and employability support for families as well. For system change, again, we set out to work out with those within the system, those who are working with these children and families, that's from the staff within the council to the schools to our wider VCS organizations. That's what we're trying to do with system change. And we had cultural humility training, which we held we organized for staff within the council and within our wider partners, or within the council. Again, was really about promoting that aspect of cultural humility among staff in the way we work, moving from cultural competency to cultural humility, and understanding that in trying to practice and promote cultural diversity in what we do, it has to be an ongoing exercise. We have to constantly learn. We have to constantly understand the best ways to engage our service users, without bias. We had to unlearn our own bias and be able to recognize cultural differences we have amongst us, especially in a borough like Newham that is very diverse. So this was cultural humility training sessions. Was a full day face-to-face session, which again was really quite impactful, because we have become so used to the online training sessions, but this was getting people back into that space where they could really talk about aspects around cultural humility, learn from others, and again be encouraged and empowered to take this practice back into the workspace. So we, with respect to transition support, we're able to then beyond having transition support for the children, we're also able to engage the staff in the schools. And for us, that was really key, empowering the staff to be able to do this, and then being able to work with the staff and see how best they can continue to promote this transition support even beyond the end of the intervention. Again, most of our work around system change was kind of co-produced, because we worked a lot with our partners. We also had our CYP service mapping, which is really one key aspect that we're able to get at the end of our work. What was it all about? It was all about, mapping the services that are available for children and young people within Newham, understanding them, knowing where they are, and being able to let everyone see what it looks like, and let everyone understand where to signpost children in need. And with the level of need that we're seeing, sometimes people had that need and didn't know what to do or where to go to. And I think just being able to map these services was a key part of work that we're able to do, and that would really help again in providing more support for children. I would highlight a little bit more about the service mapping in my next slide. We had cultural sensitivity training, and this was really focused on staff in schools and really around the topic of exclusions, because I think that's one key thing we keep seeing for the Black and Asian young people within Newham. And again, after the pandemic, we started seeing some exclusions really coming up. So we had cultural sensitivity training just aimed at, empowering staff, understanding the cultural differences for children from these backgrounds, engaging with them, how to better engage with them to understand what they are facing and their peculiar challenges, before it gets to that stage of exclusion, and to ensure that staff are doing their best, to alleviate the risk factors that the young people could be facing before getting to the point of exclusion. So this is just a snapshot of the major interventions that we're able to do, and we had our commission services, we had our commission providers, deliver majority of this work. We have Power the Fight, Paradigm Project, Mindset Matters, Get Real Youth Services, and again, at the end of the day, we had a Curtis Bright who then conducted an entire evaluation. And the numbers of the screen is just to show how much we're able to engage across the different parts of the project. Moving forward, like I said, this is just a snapshot of the whole system map. I'm sure we'll be pasting the link in the chat. And the whole aim was it provides an overview of existing services for children within Newham. It identifies gaps and overlaps, showing us how they link well with the system, from a core system within the council right down to a visitors organization. You could see how it links, and it's something that, with consultation so far, schools, visitors organizations have indicated its usefulness, and, in trying to understand what's available out there and how to then, signpost children and young people to it who are in need, and just get a clear picture of what it's all about. So again, it's one key thing that we're really planning to move forward, and it has really been quite instrumental in understanding what is available, what is not available, and how we can gain access to them. Now, as a result of all this work, this is just a snapshot of some of the key outcomes we're able to have, with mentoring, for example. One thing is we leverage so much on collecting feedback in everything that we do. We're able to do from surveys to outcome stars, to just the voices of those engaged. And for mentoring, we had a very high percentage, 97%, really admitting that the mentoring improved their ability to manage the feelings and behavior. For cultural humility training, you could see that majority, 79%, indicated that the training was able to improve their ability to practice cultural humility with colleagues, and service users, which for us is really quite a success. For the school transition support, again, the children who were engaged throughout these sessions indicated that it had improved their preparedness, about transitioning to secondary school. For cultural sensitivity training, we had a 50% increase as compared to when before and after the training, about improved confidence to take action, to increase organizational cultural sensitivity. For the parents' traumas workshop, 90%, were able to mention that improve their confidence, recognize trauma within their child, and how to manage it. Again, for the self-esteem group work, at the end of the day, the children who were all engaged, could report that their confidence and self-esteem were really quite improved. Again, this is some of the outcomes that we are celebrating at the end of the day, and our final evaluation project report will highlight more of this, and with more depth and insights into how we arrived at these numbers. One key thing, again, we're able to use to measure progress for the children and young people was the outcome stars. And for us, just a really, really call it very interactive tool for those who are aware about it, and Brent used it as well, that helped us map the progress of children we're engaging from the beginning and right down to the end. And this snapshot is just showing how much progress children were making from the beginning of their engagement to the end, for the children that were engaged across different aspects of the project. And as you can see from the screen, the highest progress was made around confidence and self-esteem, which is not strange, and which again we've highlighted as one of the key things that was coming out from all the engagements we're having. And then we also have improvements around feelings and behaviors, around friendships, around education and learning, which, like I said, again, there'll be more breakdown on this in our evaluation report. Now, this is just a case study of a young person, a 16-year-old young person, a 16-year-old child who was able to, go through the one-to-one mentoring through the Pathfinder project, and with mentors from our commission provider, the Get Real Youth Services. Now, he had presenting needs, which included depression, anxiety, poor behavior, self-harm. Most of them related to the pandemic. And again, he wasn't engaging with CAMS. But once we received the referral into the Pathfinder project, we're able to, assign the child to a mentor. And again, one thing again with our mentors were they were really quite real, they were really quite engaging, and they were really quite good at building trust with the children they worked with. So again, Karim was assigned to a mentor from Get Real Services by July. Introductory sessions happened, and the green box there is just showing what Karim said. At the beginning of the session, for someone who never wanted to engage with CAMS, he just felt like it was just going to be some dead thing, one of those things that you have to do with professionals. But after meeting with the mentors and with the trust that was ongoing, he felt like it was going to be lit. And at the end, it was really quite lit because sessions continued, activities happened around building his mental health, understanding the root causes of the issues he was facing, building relationships with his family, positive affirmations, having gym and boxing sessions. And all of this spanned through August, September. By October, the sessions came to an end. We could see an improvement in his behavior at home. Could see an improved mindset towards college, improved fitness, and this feedback was gotten not just from the young person, not just from the child, but from the parents as well. And at the end of the day, he was able to see the mentor as a friend and positive role model. And due to the impact of the gym sessions on his mental, emotional, and physical well-being, we're able to then, further support this child with a 1-year gym pass so that he could keep going to the gym and keep building that positive outlook that he was already working on. And again, it was nice to see that by June 2022, he maintained it. He was regular with that gym. He was more fit, he was more confident, and he could talk more about his aspirations, getting a job. And I think for us, this is just a highlight of what we're proud that we're able to achieve via the Pathfinder. And at the end of the day, the star up there is just showing us, a snapshot of his outcome stars when he started, and the outer figure shows us, by the end of the day. So we have lots of case studies like this, but this is just one to show us, the journey most children were able to go through the Pathfinder project, especially when it came to one-to-one engagement. We also have feedback from, everyone. We love to get feedback because that shows us if we're making positive impact or not. And as you can see on the screen, we have feedback from the children, parents, staff, and so, for example, one of the parents mentioned that the mentoring provided trusted advice for my boy and helped him cope with the loss of his brother, also helped him with football. That was very, very important for us because I remember in this case, it was someone, he lost his brother during the pandemic, and there was really no outlet for him to grieve. But the mentoring really helped him cope with that and also then help him get back into football, which is something that he was not able to do during the pandemic. So we have voices like this. We also have a video that's captured voices of our various stakeholders that we'll also share and post in the link at the end of the session. Now, what are our challenges throughout the Pathfinder project? Obviously, the pandemic itself made it because of the pandemic, the project had a slow start, and it also meant that because we're trying to engage children, it also meant that those who were in schools, we all know how the restrictions were then, so it was also not easy getting into schools. Everyone was trying to get back on board, so that made it in such a way that by the time the project started, we had to take time to put things in place. But the good thing about that is at the end of the day, we're able to pick up fast. We're able to become very dynamic and flexible, and just keep on moving things forward. We had a wide scope of activities to cover on this project. So it meant we're spread thin a little bit, you know, and in some cases we're not able to go in depth as much as we would have loved. But the good thing is for every activity that we then set out to do, we're able to see it through to the end. Again, staffing was another challenge we had throughout the project with a very small team to do so much. And, you know, the constant change of staff again within the team. But again, for us, we're able to overcome this by leveraging on the, you know, apprenticeship system within the council, the Kickstarter system within the council, and also, you know, leveraging on staff within our commission providers, as they were able to really come in handy to do lots of the work that we need to do, especially that which was when it comes to the key work with engaging children in homes, in schools. I think that really helped us a lot. Yeah, we saw multiple needs compared to resources. And, you know, I think Brent highlighted a similar challenge. But in addition to what Brent said, it was also a case of having children and families with multiple needs, you know, and not being easy for us to attend to all their needs. So the good thing was, for every time we're providing support, we're able to provide tailored support, ensuring that at least we're dealing with those that were priority, and for others we're able to signpost to other existing services, you know, and just ensure that they get access to the support that they need, even when we're not able to provide it through the Pathfinder project. The changing landscape of the borough was another key aspect. Things were changing so fast in Newham, so that meant we had to constantly adapt. We had to constantly be flexible. In fact, I would say that our success with being able to develop a whole system mapping came up as a result of this changing landscape in the borough, with lots of things happening. So that really helped us, you know, come up with something positive at the end of the day. Stakeholder engagement. Again, this project was really highly based on, it needed a lot of stakeholders on board, because we're engaging users across different sectors. In some cases, it was quite difficult, you know, engaging stakeholders, getting them on board, and sometimes it led to delays. For example, we're quite ambitious about engaging the police, you know, working with them, having training sessions with them. Now, it took a while to get them on board. It was really quite a journey. By the end of the day, we're able to do it. Although it caused a delay in our start times, we're still able to achieve, you know, what we wanted to do, which was really having sessions around cultural humility with them, and, you know, just improving their cultural sensitivity around engaging children from Black and Asian communities, especially when it came to stop and search. So again, we're quite successful with that. Now, what learning and dissemination are we taking out of this project? You know, having done all these, I could say for a fact that these are some of the things we have been able to see. The whole family approach for us was really quite outstanding in supporting children, because it's one thing to have one-to-one session with a child, and it's another thing for the child to go back home into a home that, you know, is a little bit toxic, or it could just impact all the time, the good time you're having with that child. So the whole family approach helped us not just engage the child, but the family, the parent. In some cases, we had children who were not in touch with their fathers, you know, and bringing them closer together again. That just built the family bond, and that helped, you know, in dealing with some of the issues that they were facing. And it also then helped us start, you know, providing wraparound support for families, which was more impactful than if we had just worked with them on a one-to-one basis. Now, one-to-one intensive long-term mentoring. Now we're able to do one-to-one mentoring, which again was really quite impactful. But one thing we're beginning to see is that at the end of the day, we had almost 95% of those who were engaged in the mentoring mentioned that they would have loved it to continue. So in other words, they would have loved the mentoring to expand for a long period of time. And I think that's one thing that we have as our key recommendations, that whenever we're doing mentoring, coaching, or whatever it is, the period of time that we need to do this matters a lot. And when the mentoring is linked with diversionary activities, it's even more impactful for the children and their families. The school transition program, again, is something that we believe should be a standard support for children at the transition years, especially those in secondary school. we're able to work a lot with those in primary school, with lots of results to show for it. We're able to engage some secondary schools as well. But with what we have seen, we believe that, beyond just having one-time engagements with them, something that could be ongoing throughout their transition year, is something that staff could be trained on, is something that schools should take as an initiative, to keep supporting these children at these transition years, because it's for them, it's a new thing. They're going to a new stage, and with this ongoing transition support, they will be able to transition better into the next year of their life. Collaboration with partners and VCS, with especially those in the voluntary and community sector, I think that was just a key success factor for this Pathfinder project. The fact that we're able to leverage with our partners in the voluntary sectors, those who were closer to the community, that helped us reach out to families, children, especially those who were not known to the services, and just working hand in hand with them, was really is something that I would say we should always continue to adopt as a way of, engaging children, families within the borough. Engaging, working with our community partners will always go a long way in building partnerships, in building sustainability, and, in making our work more impactful, especially for families whom we know sometimes are scared of engaging with statutory services. So for us, this was a key success factor for the Pathfinder project. Now, we mentioned that we did cultural humility trainings and cultural sensitivity trainings, and from the feedback we've gotten, it should be an ongoing exercise, right? It's something that we need to keep doing. We need to keep engaging staff, or we need to keep engaging all those who are working with children and young people from these communities. Need to keep, learning more about cultural diversity, learning more about, that unconscious bias, learning more about how to engage children from this cohort in a much, much, much cultural sensitive way. And especially not just for staff, but engaging senior leaders as well as part of this training will really go a long way in promoting a culture of cultural sensitivity within an organization. The whole system mapping, again, is something that we believe could be adopted by any other borough, just mapping the system together, linking up everything, and understanding how to keep updating it, seeing those gaps, and it will go a long way in providing access to support for children and families. The outcome star is also another key tool. Really, I think it's a very innovative tool that could really help us map progress when we're working with children, families, and again, early help and prevention. You see, we set out to try and deliver the kind of work that will prevent children from coming in contact with the youth justice system. So for us, early help and prevention is really something that we should be proactive about, just like we have seen from the Pathfinder project, because it means we're able to engage with risk factors before they even come in contact with the youth justice system. Now, our next steps in Newham, the Pathfinder project, the Pathfinder project came to an end. We're able to transition into the Disproportionality Challenge Fund, which again was a project set up to provide access to support for children and young people at risk of coming in contact with the youth justice system. That means that for those who still needed support from the Pathfinder project, we're able to transition or link them up nicely into this project again. And one good thing about it, we're also then able to leverage on our community partners, that we worked with on the Pathfinder project. That meant that those relationships that were built could continue and really helped in supporting the families as well. We're also advocating, for the whole system mapping tool to become, to be adopted and, become a way of working within Newham in such a way that we could keep making reference in it to see how the whole system of supporting children and young people looks like, what we could do, identify gaps, and share it wide so that schools, VCS organizations can use it to know where to signpost children who are in need to. Again, other projects and work streams that have come up since the Pathfinder project have been able to benefit really from the learnings from the project so far, especially when it comes to engaging children and families, and transition work in schools. So we've been able to constantly share things from the Pathfinder project with these other projects or services that have come up since the end of the Pathfinder project. Again, conclusion and dissemination of our final evaluation report, which I believe would then, paint a clearer picture and an in-depth picture on everything we're able to do around the Pathfinder project, and just highlight the key outcomes that we set out to achieve, how we achieve them, the challenges, and further recommendations moving forward. So I would say the Pathfinder project really, like I said at the beginning, has been an interesting journey. And it has not, the success really was really based on, the team putting the work, the support from the Youth Justice Board. We had a very proactive steering group that was able to really lead, guide the project, and help the project adapt to different changes. And again, our partners in the voluntary and community sector were very, very key in supporting us achieve the results we see today. So it's something that we are proud of, and we've engaged children, families who still speak well of the impact it's had on them. So I think this marks the end of my presentation for today, and thank you very much.
Thank you, Chima. I can see there's been questions put in the chat. We will come to those after the next presentation. And just to remind everyone, we will share the presentations and the recording after this. We have other links as well for you guys, so you can look at children's journeys as has been mentioned. We have a short recording from Brent. We have a celebratory victory from Newham. So we intend to share all of that with you post webinar. I would like to now hand over to our final guests, Caitlin and Hannah. They're going to run us through the evaluation from Cordis Bright. So firstly to Caitlin.
Great. Thank you so much, Shahan, and to Nicola and Chima for your super interesting presentations. It's great to be here today with all of you discussing the great work of the Pathfinders. Yeah, my name's Caitlin. I am a senior consultant at Cordis Bright, and we were commissioned to conduct the evaluation of the Pathfinder programs across both Brent and Newham, which I project managed. My colleague Hannah is also here with me today. She's project director on for the evaluation, and she'll be kind of taking over from me a little bit later on in the presentation, so you don't get too much of me talking. So just to start off with a really brief overview of the methodology that went into our evaluation. First of all, there was a really wide-ranging stakeholder consultation. So we conducted interviews with council staff, programme staff, delivery providers and partners. A big thank you to, I think, a number of you on this call who were involved with that, really useful insights. We also conducted interviews with children and young people receiving one-to-one mentoring across both Brent and Newham and some of their parents. Again, another big thank you to people on the call for helping facilitate that across the provider partners. There were also some focus groups, both the children and young people accessing group activity. So that's the kind of transition support that Gina was talking about in Newham, and also that youth panel in Brent. They were really, really interesting, valuable group discussions with the young people. There were also some supplementary outcomes-focused case studies conducted about young people receiving one-to-one support in Brent particularly. And finally, then there was the quantitative data, which has been mentioned a bit by both Nicola and Chima. So we conducted analysis of Pathfinder programme data, which includes some monitoring data, activity data, and that outcome star data, as well as offending data. So that outcome star data has been discussed a little bit already, and was really useful. We had pre and post outcome stars for most young people, which allowed for a change over time analysis to get a bit of a sense of how things had changed on that kind of 5-point scale that Nicola mentioned. However, we should just give the kind of the slight health warning that the extent to which we can draw really kind of rigorous conclusion about cause and effect is limited somewhat by the lack of a comparator group. And that wasn't feasible within the kind of time and resource available to this evaluation, but might be something to consider going forward if we want to kind of build on the positive and sort of promising evidence that has come out of this evaluation work. So the focus of the evaluation activity and this presentation was particularly on the Pathfinder work that engaged and supported children and young people and their families directly. And we've heard loads of great stuff about that from the presentations so far. So just for the purposes of thinking of putting some structure on that for this presentation and the evaluation, which looked across Brent and Newham, we've divided that into the one-to-one intensive support. So particularly mentoring delivered by YBF and each in Brent and Get Real Youth Services in Newham. And then that kind of group-based and more open access support, which focused on promoting young people's voices and participation in Brent in particular, and on schools in Newham. There was, a bit of Newham was doing a bit of the stuff about young people's voices. Brent was also doing some of the work in schools as well, as you've heard. But for kind of those were the particular focuses we chose for each site. We'll also touch briefly on the Pathfinder system level activity, which aimed to improve systems of support and tackle discrimination and disproportionality in Brent and Newham, again, which you've heard a bit about. So who did the Pathfinders reach then? The Brent and Newham Pathfinders supported really successfully their target group of global majority children and young people with really relevant set of needs, children and young people impacted by COVID-19, and children and young people not previously known to services or not having their needs met by services. So the target group then in both sites, the two most common ethnic backgrounds of children and young people were Black, African, Caribbean, Black British, and Asian British. So that shows that across both sites, the Pathfinders were reaching their kind of really core target group of young people effectively. Children and young people with relevant needs, you've heard a bit about this already, but across both of the sites, the top 6 needs that were recorded for children and young people coming into the programme were household conditions and poverty, mental health needs, challenges with education, social isolation, risk of abuse or exploitation, and behavioural issues. And a lot of those, as we've heard, were either kind of created by or really strongly exacerbated by the COVID-19 pandemic. So that's the next point, which is that the Pathfinder really met the needs of children and young people from communities which were collectively disproportionately impacted by COVID-19. And they did provide support with some directly kind of COVID-19 related needs, some of that, some of those issues of isolation that came from having to not be in school, some of those issues like that. But overall, they really prioritised whichever issues were most important to children and young people. So it was a kind of really child-centred, tailored approach. Children and young people not known to services. So from the monitoring data, it looks like one-to-one support successfully supplemented support from local authority services. So really kind of plugging a bit of a gap in the system. So that was reaching children who were known to local authorities, but who still had some kind of unmet need. And we heard a bit from Nicola about some of the issues with waiting lists, etc., for things like mental health needs. And so the Pathfinder was really able to kind of plug a bit of a gap there and get that support quickly to children who needed it. There was also a sort of more open access preventative work delivered in schools through things like that wellbeing roadshow that Chima talked about, and community centres. I'm going to talk a bit about the one-to-one support then, and really kind of dive in a bit on the impact that had and how it created that impact. I'll then pass over to Hannah to take on to talk about that group support and also the more system-based activity. So the Pathfinder's one-to-one provision offered support to those who needed it, successfully enabled engagement, and provided positive experiences for the children and young people that it supported. Key factors which we found contributed to this success across both Brent and Newham and across the different providers in both was the provision of personalised, enjoyable activities which really encouraged engagement and introduced children and young people to just really, positive activities to fill their time. So that could be sport. We heard lots about that from Chima in Newham about introduction to boxing, fitness, etc. Could be music. We heard some things about drama. It was really a really varied offer to make sure that there was a kind of a hook that could be tailored to each individual young person. Flexible engagement and contact then was really important in allowing children and young people to engage in locations and times that they felt comfortable. And then finally, it was about building positive, trusted relationships. And practitioners were matched with children and young people based on shared interests and experiences, and were seen as relatable and non-judgmental as a result. And we kind of saw that, how that played out in that kind of case study that Chima showed, where that young person initially thought this was going to be some kind of dry intervention, and then met their practitioner and was really excited about it. I think that's something that we heard quite commonly from the children and young people supported. In terms of impact then, it seems from the data that the Pathfinder supported some children and young people to manage their behaviours more effectively, and also to make more positive choices of friends and activities. And this was achieved through a range of different mechanisms. So there were some tools that practitioners would provide children and young people with. So kind of tools to manage their anger, how to deal with, if anger or difficult emotions came up, to avoid acting out, strategies, and also those diversionary activities we've already talked about to kind of channel, I suppose, those feelings in a more kind of productive way. So you can see on the right there, that is the kind of the change in outcome scores, the mean change in outcome star scores across each of the 3 providers of the one-to-one support. So we've got the 2 providers in Brent in the blue, and then the provider in Newham in the orange. And you can see that there's a significant increase across all of those providers. In terms of children's stories, then we heard from brothers Rory and Darius, not their real names, who both received YBF mentoring Brent. Their mum was worried about who they were hanging around with and worried about them getting into trouble. Their mentor helped Rory and Darius understand the negative influences in their lives and the pathways amongst their peers, and also to really see the impact on them and their family. So they did this kind of mapping exercise about that impact. And both brothers reported that they were more aware of these influences and had consequently moved away from them. So that was really positive. Then we've got the impact on emotional well-being. So the Pathfinder supported children and young people to improve their well-being, confidence, and self-esteem. So the mechanism here was really the ability of children and young people to open up to their practitioners, who, as mentioned, were seen as relatable, non-judgmental, a kind of an open ear. And some young people did receive kind of direct therapeutic input, specifically those who were accessing EACH in Brent. They were able to access CBT and motivational interviewing inputs if required. So, again, you can see clear shifts in the outcome star scores in the diagram on the right. And then there was also the story of Karine, who began receiving mentoring in Newham. When she did so, her mum described her as being in a very dark place. But Karine and her mentor were able to discuss strategies to help her anxiety. And Karine has since started going out with friends again and transitioning back to school. And both Karine and her mum, when we spoke to her, said that the mentoring had contributed very, very directly to Karine's improved mental health and ability to, go out and about and engage positively. So that's really positive. Impact on engagement with education then. Education was obviously hugely impacted by the pandemic, as we've heard from the previous presentation. So that was a real kind of area of focus that came up a lot when we were speaking to people. It seems as though the Pathfinder supported more positive engagement in education, including better attendance, behaviour, and relationships with teachers. Sometimes this was due to practitioners helping to identify and address underlying issues with going to school, accessing education. So that might be, either kind of a child being in an unhealthy routine of going to bed too late, spending too much time online, and therefore not being able to get up in time for school. It could be sometimes kind of children feeling unsafe on the way to school and helping them to deal with that. Other times there was actually a more direct mediation approach taken with the school. So that could sometimes mean practitioners going in and speaking to teachers, explaining to them the issue that the young person, the child, was facing, and then kind of helping them to understand each other and, I suppose, respond to those needs a little bit better. And that was very clearly the case for Leroy, who accessed EACH support in Brent. So Leroy was really struggling to engage with school and was getting into trouble a lot. And when each practitioner supported him to understand kind of what he was struggling with in school, and then communicated that directly to Leroy's teachers. And this helped the school to work better with him and improve their relationships. And you can see in the quote here from Leroy's kind of practitioner that the partnership with the school was what they felt made the kind of the key difference. And we've heard a lot about that from Chima and Nicola, the important role that schools have to play in all of this. It seems like that's kind of really, really vital. Impact on family life then. Well, both the Pathfinders aimed for a whole family approach to support. The extent to which this could be implemented in practice varied a little bit. And it was also quite challenging to evidence the impact of this work because of its kind of varied and needs-based basis. So the way it was applied and the extent to which it was applied varied quite a lot by young person, depending on need. But there were examples of positive changes identified, particularly in the kind of qualitative consultation that we conducted. So it seems as though, where it was needed, one-to-one Pathfinder support helped to create a calmer family life and improved family relationships for some children and young people. And again, there's kind of two mechanisms there. There was the direct impact. So sometimes that's a kind of direct mediation role that the practitioners were playing, kind of going in and discussing family relationships and consequences of actions on family members with the young person, sometimes kind of literally getting the parents and children together and kind of mediating discussions between them. And then it was also more indirect, so through children and young people's behaviour generally improving, their well-being improving, and then that having a knock-on impact on the family home. And then finally, then it's about this is about the impact on risk of offending. So we did get some police data which showed that most children and young people receiving one-to-one support had no police contact at all during the programme. For those who did have contact, it's difficult to judge. For those who did not have contact, it's difficult to judge if they would have done so if they had not received any support. And for the few who did, a multitude of factors will have contributed, many of which will be beyond the Pathfinder's control. So that's just sort of a slight kind of health warning to say that the extent to which we can read in to the impact that these figures suggest the Pathfinders had on risk of offending is a little bit limited. But that said, aspects of the support could clearly have contributed to a reduced risk of offending. Some of those things we were hearing about in terms of diversionary activities, supporting children to kind of manage difficult emotions, improving well-being, etc. But the programme wasn't really very specifically targeted at children who are known to be directly at risk of offending, and therefore wasn't super tailored to that anyway. So really, rather it was aimed at providing support to children and young people who needed it, helping those young people to improve their outcomes. So it's very much that kind of preventative early intervention stage support, and seem to be doing that really, really promisingly. I am going to pass over to Hannah then, who's going to take us on to cover a bit about the group support and system work that the Pathfinders did.
Thanks very much, Caitlin. Nice to see you all. Thanks for joining us, and thanks for sticking with us until this point in the presentations. So I'm going to talk a little bit about the group-based support. You've already heard some information from Nicola and Chima about the different elements of group-based support in the two areas. But I think a reason why it's useful to shine a bit of a spotlight on this is that, first of all, these are a different mechanism for engaging and supporting young people, and they have the potential to reach them at an even earlier stage of need, because they can be delivered more universally, or can be kind of offered to young people who might not necessarily meet the threshold for the more intensive one-to-one support in a system where that support is in high demand and where you have to make difficult decisions about who can go on and receive that support. And therefore that means that they can be an entry point into further support for young people who need it, because it might be the first point at which somebody's receiving input, and then needs or support areas are identified at that point in time. The second reason why I think it's quite useful to spotlight them is because they align well with some of the more systems-focused aspects of the Pathfinders. This is because they kind of build in engagement with specific partner organisations as part of the model themselves. So in Newham, this is about working differently with schools, and as we've heard, schools are key partners in the ability to identify, engage and support young people who might be at risk. or who might be experiencing poorer outcomes. And in Brent, it's about mobilising the voices of young people, which can help to change the perspectives and understandings of system stakeholders. So there's a kind of element of young people contributing to shifting attitudes of those who might have power to make decisions in a system. So I think they're interesting in that respect as well. So to talk a little bit to the Newham support, Newham, thanks, Caitlin. Newham mainly focused, as Chima's spoken about, on transition support, particularly focused on those moving between primary and secondary school. And that was a really successful component of the support, and it reached nearly 400 children and young people over the course of the Pathfinder, the majority of whom were primary school age, although there was a small amount of transition support also delivered in secondary schools. And sessions covered things like identity, friendships, bullying, practical support and advice in preparing for secondary school. Alongside that, there was the self-esteem group work in schools that Chima spoke about, and that was introduced in the latter stages of the Pathfinder, which was in response to a need identified in children and young people that had been observed by those already referred into the Pathfinder. So that was quite a useful example of being able to adapt provision during the implementation of the Pathfinder programme in response to something that had been learned along the way. And then the third component of the schools-based support was wellbeing roadshows. And these were delivered as a kind of pop-up shop in 15 schools and also in 5 community centres in Newham over the course of the Pathfinder period. And they reached in a kind of light touch and more universal way, getting on for 2,000 pupils in Newham. And I guess when you think of those things as a package, one of the things that I think is particularly useful about this approach that Newham took is that those wellbeing roadshows can be a kind of way in with schools. So offering that one-off session, which is relatively easy for a school to accommodate and organise themselves around, and which provides input to a large number of children that might kind of enhance curriculum provision and enhance PSHE provision, is a really good way in, which can then build relationships with those schools to enable you to offer those more targeted interventions like the self-esteem group work and the transition support. So that was a really useful kind of model that Newham used for their group-based support, and a really effective way of engaging schools that could be transferable potentially to other areas or to other types of programme. So then to talk a little bit about the Brent group-based element, as Nicola discussed, this was the kind of youth panel component. And again, this was very successful in terms of its reach over the course of the Pathfinder period, and over 100 young people took part in youth panel activities. And the youth participation worker was really successful in recruiting young people very quickly, because he engaged, I think, about 90 of those children and young people over the first 5 months of his delivery period. And I think one thing we maybe haven't spoken to so much in the earlier presentations is some of the kind of mechanisms that he was able to use to engage those young people. So firstly, young people and staff members told us that the fact that there was a focus on podcasts and on producing podcasts was quite a valuable engagement mechanism for the young people. That was really something that distinguished this from other youth programmes that might be operating at the time and in the area. So they drew young people in. It was appealing to take part in a podcast. But equally then the podcast, in terms of that kind of systems element, is a really useful output, because then you have that podcast and you can use it to engage other system stakeholders, to share these young people's views and experiences, and to kind of galvanise people around what might need to change to better respond to those experiences and needs. We've heard again about the kind of value of reaching young people in schools, and the youth participation worker was able to kind of tap into that as well. But the other things that the youth participation worker did really successfully was building a relationship with the young person and their parent. And that was quite a lot of informal one-to-one support, quite a lot of ad hoc response to things that parents or young people were raising. And then also creating a kind of supportive and open environment for participation. So young people feeling that they could kind of dip in and out of engagement, participate in the parts that they were interested in, and also that when they were in that space, they felt really comfortable to a point where they could express their opinions and not feel judged. And I think the reason why it's important to talk about those last two elements is that one piece of learning, I think, from implementing this youth panel is how resource intensive it is to both kind of get it off the ground, but also to maintain it. So I think areas who are looking to implement something similar and looking to resource that, it's really useful to reflect on how much of at least one person's, if not more people's time you need just to keep that ticking along, and to make sure that it's kind of a safe and effective space for the young people. So that's a little bit on the kind of group support. And then I just wanted to move on briefly to touch on some of the kind of more systems elements of the Pathfinder activity. So I guess the first thing to say here is that the Pathfinders strengthened the focus on support for global majority children and young people, as we've heard, and they brought together partners with the shared priority of specifically helping those children and young people. And we've heard about the joint working with the voluntary and community sector and schools that showed promise of effectively identifying, engaging these children and young people. And I guess what that did is really act as a kind of platform for both the work that was happening during the Pathfinder, but also for future work. And I can see that there's a lot of questions in the chat around kind of sustainability and what happens after the Pathfinder. And I think these partnerships and having time and specific resource injected to continue to build these partnerships in the form, for example, of the kind of program managers who were working on these programs is one of the added values of the Pathfinder and of the Pathfinder funding, because it gave people a bit more time and space to focus on those partnerships, which everybody is trying to build as part of their day-to-day work, but which do actually need time to nurture and thinking to kind of nurture in a purposeful way. So I think that's the kind of added value of the funding there. And I guess as part of that, the Pathfinders activity will have generated learning on how to meet the needs of children and young people from specific global majority groups. And the kind of next steps probably for Brent Newham and also for others who might be able to learn from aspects of this is around how that can feed into a kind of concerted system-wide programme of activity. And that's not something that you can deliver with, you know, a piece of time-limited programme funding. And it's obviously something that stakeholders working to support children and young people are focusing on all the time, but translating what people have learned into ongoing activity around systems improvements is kind of an important next step for the Pathfinder areas. And in particular, a couple of things that look really promising to build on in this area are the training offers delivered to system stakeholders in both boroughs. So in Newham, the training focused on specifically on kind of tackling disproportionality and discrimination through cultural competence and cultural humility training. This reached more than 300 staff in the area. And you can see that the cultural humility training was targeted more at Newham Council staff and at wider partners and police, and cultural sensitivity training was targeted at school staff and voluntary and community sector stakeholders. A consultation that we did with system stakeholders, but also feedback that the training providers themselves had gathered suggested that the training was impactful for attendees. And in particular, the cultural humility training, people described as feeling quite new and impactful and encouraging people to kind of improve awareness of and also question their assumptions in the context of their practice, which also helped them to be more person-centred. So that felt like a really kind of valuable system level activity that could be expanded or continued following the Pathfinder. And similarly in Brent, the training there focused on trauma-informed approaches and was delivered to just over 90 system stakeholders. And here kind of targeted Brent Council staff, the voluntary community sector, school staff and police. And it aimed to improve understanding of trauma and to provide strategies to implement the trauma-informed approach in practice. And again, the consultation suggested that this is a promising approach which would have the potential to impact on practice if it were rolled out more widely. So it's a good kind of injection of a training approach into the system that potentially could be built on in the future. And I'm just going to wrap up by touching on some of the recommendations for future development from the evaluation. I don't want to spend too long on these because I think a key element of this webinar today is really to speak to some of the successes of the programmes and some of the things that that people might be able to take forward. But as always, in delivering these kinds of programmes and in designing these kinds of programmes, there's learning that can be extracted that could inform what could be done differently next time. And again, I think there might have been a couple of questions in the chat about this. So I won't run through all the recommendations individually, but we've grouped them into recommendations for how to kind of more effectively contribute towards systems change, recommendations around commissioning and implementing the programme activity itself, recommendations about partnership working in the system that apply to the programme, but also more widely, and recommendations about supporting young people and families. And I guess a couple of things that I would probably pull out from here are that value of harnessing and promoting young people's voices and views. And I think that's something that both programmes sought to do and probably did to different levels of success. But in terms of the things that resonate with wider stakeholders in the system and with, for example, more strategic stakeholders or those who might be involved in designing and implementing programmes, having a kind of readily available resource that can capture those young people's voices and can help to project them in is a really useful component of the work that the Pathfinder has done, and something that it's probably really useful to build on. And I think there are probably ways that could be, if there's resource and appetite, there are ways that could be extended, so that as well as kind of capturing experiences about specific topics and then feeding those in, more directly involving young people in some of the decision making about programme design or about commissioning and about what is being taken forward in the system is probably a kind of way to build on that. And then the other kind of important piece of learning that I think people really stressed over and over again, and we do hear this in a number of other, we have heard this regularly in other programmes that we evaluate, is that the value of this kind of programme can be in really foregrounding the role of the voluntary and community sector and of kind of smaller grassroots organisations in being able to effectively engage young people who might not necessarily have been well reached by other services in the system previously. And that's something that stakeholders kind of emphasised to us multiple times during the consultation. So I think that's a kind of key recommendation to focus on as well. But when our evaluation report is hopefully published, we're just in the kind of finalising stages at the moment. There's more detail on all of those within that. So if people are interested, they'll be able to kind of dig into what we're suggesting and why a little bit more at that point. And that is me all wrapped up. So I think I'm going to pass back to Shahan. Thanks very much for listening.
Thank you, Hannah. And thank you to everyone for being patient. I'm sure that was a lot of information thrown at